Hey there everyone, how's it going? So in an effort to be more, I suppose, engaging on Facebook, I'm gonna make a little bit of a vlog series or blog, what do they call it nowadays? So please comment below, any questions. I'll try my best to answer them. I'm gonna also try to look into the camera, which is weird for me. See me? Alright. Gonna talk a little bit about dental implants today, and something that I find patients ask me often. Alright, so let's talk about missing teeth. So, in this situation, you're missing a lower premolar, right down here. And I always tell patients that there are three options. Of course, the first option is to do nothing. No one's gonna force you to do really anything, but you have to be aware that if nothing is done, eventually these teeth will sort of drift together. This tooth will sort of drift over, and it can create issues. It's not the best option, of course. So the second option is to do something that's called a dental bridge. For a bridge, what we have to do is we need to shave down the adjacent teeth. That's all fine if these two teeth perhaps, are root canal treated, or if they already have crowns. But what if they're healthy teeth? So some things to consider. But dental bridge, okay, which is custom fit for these teeth, and then it's cemented on. It's very hard to clean in here, okay? You can't floss because this is a single unit. So what you have to do is actually use something called a floss threader. I am always very impressed when I find patients who actually have floss threaders. What you can actually do is run the floss in, out through the other side, and then you can basically clean underneath the bridge. But we have that in the office, so we got you if you have a bridge. Placing a dental implant. Now, whether you place that at the surgeon's office or at the general dental office, this will generally take about 3 to 4 months to heal. So once that's placed, we're gonna wait some time, and usually the surgeon or the general dentist will place what's called a healing cap. Okay? That healing cap will basically expose that implant out of the gum. And now you can take impressions and you can access the implant. What you will get back from the lab is an abutment. And the abutment seats on the crown. We take an x-ray to make sure that it's seated fully. And the lab will also make a crown that's custom fit for this abutment. And then that is cemented onto this abutment. Okay, so this is option 1. The second option is when the abutment and the crown are one piece. So let me show you how that looks like in this model here. The abutment and the crown in one, okay? And it gets placed in, and then it gets screwed down with this driver. With the cementable option, we screw down the abutment. So it's very similar. But now you're probably asking, what about that hole? Well, don't worry, that hole gets covered with composite. It's tooth colored, and it actually does a really good job blending it in. So 2 options, pros and cons. The biggest thing with, where we always try to go this is called screw retained. This is called cementable. So we'll always try to go screw retained when we can, and the reason being is there's no cement to potentially overflow and damage the implant. And the second reason is if there's anything that ever happens to the crown or to the implant, we can easily go back in and unscrew the crown, which we can't necessarily do with the cementable option.